Hi guys, it is X. Welcome back to my channel for another nursing video. So I wanted to start a series on electrolytes because I feel like that is something that a lot of people struggle with when they're in nursing school, with just how many things to know about all the electrolytes, how some sound the same. Like for me, calcium and magnesium kind of had the same similarities. So I kind of wanted to talk about magnesium today. I don't know why this was one that just kept popping up in my head, and I was like, we have to talk about magnesium. So basically what I'm going to talk about is different medications, different usages, how to treat high and low hyper and hypo magnesium. So yeah, if you guys want to know more about it, just keep on watching. But before you swipe me away or click me out of this video, please like, comment, and don't forget to hit the subscribe button. Thank you. Okay, so literally the first thing that I do when I go get report after is write down on my labs. It is very important to me to understand my labs, and I always pay attention whether they have been replaced or not. That is just something that is on my high priority list as a nurse. So magnesium, everything that I'm going to teach you, please take with a grain of salt. Please look at the video timeline when this was made, because obviously we are in an ever growing, learning, new evidence-based practice. So I don't want you to look at this video and it's like a year old and things have changed for anything that I'm teaching you. So the levels for magnesium that I'm going to give you, I want to make sure that you look them up yourself. Anything that I say, please look up yourself. And the reason for that is because every hospital kind of has a level of what they believe is a normal range. So when I was looking this up, it was saying that normal or hypomagnesium is less than 1.5. So I'm actually going to give you a range of a mag level of 1.8 to 2.1. My hospital, if it's less than 1.8, we replace magnesium. But the books that I was reading, it said that it wasn't considered hypo until it was less than 1.5. And then for the elevated level, my hospital, I believes it's anything over 2.1, but the book told me 2.5. So I just want you to make sure that you follow your hospital policy. So for hypermagnesium, causes could be like chronic kidney disease or ingestion of magnesium salts, whether it's medication such as milk of mag and stuff like that. So I really just kind of want to talk about a couple things, and I'm sorry if I'm going to look down because there's just so much information that I did not want to forget. So you can get magnesium from green vegetables, nuts, bananas, orange, peanut butter, and chocolate. If you have a hyper level, if it's over 2.1, you can treat it with 10% calcium gluconate. And if the renal status is okay, you can give Lasix. So if you're a nurse and not an NP, be sure that you anticipate those orders. So signs of hypermagnesium is decrease in deep tendon reflexes, a widened QRS, hypotension. It is a vasodilator, respiratory depression, and you can go into cardiac arrest. It says with levels between 12 to 15, and I did get this in a book. I did get a wide variety of sources. So I looked at a med-surg book, up to date, a couple of lectures that I've learned when I was in the ICU, and then lectures that I have learned in school. So I kind of wanted to talk about those things. And then hypomagnesia can be caused by protein calorie maldeficiency, parathyroid disease after you remove it, chronic alcoholism. I feel like that is one thing that is always an issue in impaired renal or GI function, prolonged TPN, loss of body fluids in an NG tube, and let me see, hypercalcemia. So some signs and symptoms are going to be anorexia, nausea, vomiting, weakness. I always get these wrong, but I like the way you say it, but Schrostick sign, and I believe also Trousseau's. I thought you can see it in both, but like I said, look everything up for yourself. And then tremors, seizures, muscle fasciculation. So the next thing that I wanted to talk about was kind of go through a head to toe of the uses of magnesium and like what we use it for in the hospital. I cannot wait to get to the potassium level, because there are just so many people when we talk about vaccines and how it is bad to give, you know, potassium and it kills people. And I'm like, I just can't wait to get to that lecture to understand and make you understand why. But anyway, back to magnesium. So neuro-wise, we use it in obstetrics for pregnant people with eclampsia, preeclampsia. I am not an OB nurse, so I don't know too much about it, but basically it is a muscle relaxer. And I'm going to kind of tie that into how we use that with TTM. So it is a muscle relaxant. They do give it to women who are preeclamptic, eclamptic. Eclamptic for sure, preeclamptic I have to double check because, like I said, I don't do OB. We also use it for TTM. If you don't know what that is, that's targeted temperature management, also used to be known as hypothermia protocol. And the reason why is because if you actually have too much magnesium in your system, it is like a paralytic. You can be paralyzed. It stops your deep tendon reflexes. It like basically slows down your neurons and stuff like that. So the action potentials are decreased and you don't move. And when we do targeted temperature management, the point is to decrease oxygen consumption in the brain. So we want these people, we don't want to paralyze them if unnecessary. So we do use things to prevent shivering and stuff, and that is part of our anti-shivering protocol is magnesium. Another thing is I actually use magnesium for migraines. It does help with migraine headaches, so I'm not exactly sure the mechanism of action for that, but you can use it for that. And continuing on this muscle relaxant issues, people use magnesium to soak in Epsom salt. Give me 1 second, let me grab the bag because I need to see what formulation it is in. Okay, so I grabbed my bag of Epsom salt and it is actually mag sulfate, and you can use this to soak in water to help with your muscles, and you can use it as a laxative. I was actually kind of surprised to see that it was sulfate and not citrate, and I'll explain that in a second. But basically, mag sulfate is what we use intravenously for replacement in what we, if it might have a level that's under 1.8, I'll usually give like 2 grams of mag IV over the course of like 2 hours. And then this, I was surprised. I was honestly, okay, I did an Instagram story a couple weeks ago, and I was actually surprised that you can ingest Epsom salt. And I'll tell you the reason. When I think of Epsom salt, I usually think more of a soaking product, not something really you ingest. And then I was like, duh, it's a laxative. Like, but when you buy mag citrate, that is the actual laxative that I know of. It's an osmotic laxative, and I'll teach you in that in a second. But let's go back to cardio. We'll go to GI in a second. So for cardio, it is a very important cardiac electrolyte. So I know I'm not cardiac open heart trained yet, but all the cardiac nurses, when I give them report on a non-STEMI or a STEMI patient, they always ask what the magnesium level is. Every type of subspecialty always has like a preference of electrolytes. Like if you're a neuro nurse, you're probably going to pay attention more to sodium and stuff like that. So for cardiac nurses, I know they pay attention a lot to the potassium and magnesium. So heart, if you have torsades, sorry, I was trying to think of the actual hypomagnesia. If you have a low level of mag, it can cause dysrhythmias, and you can go into torsades, and the treatment that you would give is magnesium for that, and I believe it is 2 milligrams IV push. Let me double check. Okay, so my reference actually says that it is 2 grams in 10 milliliters of D5 IV push. 2 grams is a lot. trying to think. Like, that is a lot compared to what we give, because I want to say, no, do we give milligrams or grams? No, actually it might be grams. I might have to fix that in the video. I could have swore it was milligrams, like when I hang it IV, but okay, I'll have to double check. But anyway, so yeah, we use that. I said it is a vasodilator, so it can cause hypotension. So that is another cardiac related issue that you can have. And then let's move over to GI. Okay, so there are multiple types of laxatives, whether it's a stimulant, a bulking agent, or an osmotic laxative. Magnesium citrate and then our magnesium salts in general are an osmotic laxative. So basically when you ingest these, it takes 2 to 6 hours to produce a bowel movement, and the reason why is because it brings fluid from the bowel into the intestine, and it kind of just, you know, makes your, I want to say it like makes your stool softener, and it just, everything flows. So yeah, that is the use of magnesium for your GI. It does give your stool a watery consistency, and they usually use that as for like bowel prep, which if you've ever had one of those poor patients, I don't know how they drink that whole gallon of Golightly. I don't know if I would be able to do it. I just hope I never need a colonoscopy. Okay, so the actual explanation does say what I said. It is poorly absorbed salt that draws water into the intestinal lumen. The fecal mass softens and swells, water stretches, and peristalsis is stimulated, and out everything goes. Okay, so the actual explanation does say what I said. It is poorly absorbed salt that draws water into the intestinal lumen. The fecal mass softens and swells, water stretches, and peristalsis is stimulated, and out everything goes.